Why do we need neurosurgical care in Liberia? Is it possible to build a neurosurgical system? We have a vision to see Liberia with a high-quality, sustainable neurosurgical system. It's a big goal, one that we can't accomplish on our own, and some days it almost seems impossible. But we strive towards this goal, believing that day is coming soon. For over 20 years, KBNF has partnered alongside West African health leaders to develop high-quality neurosurgical care. Anticipating this future in Liberia, we reflect on the past to inform our present and how best to partner with Liberian ministers of health, government officials, nurses, surgeons, and health professionals.
Neurosurgery is absolutely important, and I think it can be the core of healthcare in Liberia.
Having neurosurgery unit in Liberia is paramount.
People are dying if nothing is done. So one of the ways neurosurgery can be a priority, people can see it, we have to look at it from the perspective it's a human right.
In a given week, we receive over 50 spine injury and head injury. So if we do not have a neurosurgeon or there is no neurosurgical unit, it will be challenging in caring for these patients.
Definitely there is so much benefits that we may not comprehend.
No baby should die from congenital abnormality that is neurosurgical that could be corrected. I think we should. It's a human right.
I think it is our duty and our responsibility to ensure that specialties like neurosurgery are greatly developed because it meets our Liberian people at their state of need.
Achieving these goals will be no easy task. The obstacles are monumental.
Liberia health system is not where we all wish for it to be. There are huge challenges.
Counting from 0 to 10, I will place us at 2.
You have a lot of very brilliant practitioners, nurses, doctors, surgeons who are, very skilled, and sometimes the lack of resources limits that.
And I look at healthcare system like a high jump. Whenever you jump the bar, what happens? The bar is raised to another level. And so gradually we can raise the bar within the practice of healthcare services in Liberia.
No audacious, wild, nation-changing dream is ever easily accomplished, and sometimes progress can feel slow. But sometimes there are special moments where you catch a glimpse of the vision becoming a reality. During our most recent mission, as over 40 people from nearly a dozen nations came together to work towards this goal, we saw this happening again and again. We saw nurses and hospital staff trained in critical neuro-nursing techniques during our 2-day training. We saw how critical the hospital beds, linens, surgical drills, medicines, and supplies are to supporting neurosurgical care in Liberia. And we saw 26 patients receive life-changing surgeries, operations they otherwise would not have been able to receive in country.
That holistic approach of Korle-Bu plays a pivotal role in the development of healthcare system in this country.
There is no way the history of neurosurgery in Liberia can be written by KBNF.
If KBNF didn't do it, massive brain tumor, those pituitary brain tumor, we don't have the capacity to do it. There are people, the tumor is sitting in the cellar, they are getting blind. All right, so KBNF comes. If you don't come, it's a death sentence to those people.
But even more important than programs, equipment, and even operations, we saw kindness and compassion, laughter and love, hope and healing. The future remains challenging for Liberia's healthcare system, and yet we remain steadfast in our commitment and ultimately hopeful.
In 2011, there were practically 60 doctors in the entire country. Now, there are more than 500 doctors. Just imagine the next 5 to 6 years. I think there will be a complete turnaround in terms of the provision of healthcare services to the people of Liberia.
My hope is that within the next few years, we'll be able to build a healthcare system that will work not just for the elite, but that will work for everyone. So that is my hope. It's going to take a lot of work. It's going to take working over time to make sure that this is achieved.
Change will come, and we're gonna do it.
When somebody who is suffering, somebody who has no hope suddenly gets hope, It's like sunshine.
And as we continue towards working towards a better tomorrow, we thank you for the support you've provided so far. In the coming year, we'll continue working towards this audacious dream. Would you consider joining us as we look towards the future of better healthcare in Liberia? Let's make neurosurgical care a shining example of what can be done through partnership, collaboration, and determination.